We have Dr. Adam Alexander of OU Health Sciences Center with us. Thank you so much for joining to recap and reflect on the South of 8th project, which you were such a big partner and collaborator on. We were so grateful for the role that you played, and having representation with OU there was really pivotal to the work we were able to do. So thank you for joining me to talk about South of 8th.
Thank you for inviting me. It's a pleasure to be here today.
Thank you. So can you start out by telling us a little bit about your role at OU and what you do?
Yeah, so I'm an assistant professor at the TSET Health Promotion Research Center. I've been there about 5 years now. I do a lot of community-based research, particularly in the Black community here in the city, but across the state. I really like to address issues like prostate cancer screening, tobacco cessation, knowing those are really driving a lot of poor health outcomes we see in those areas.
Mhm.
And I really enjoy doing technology-based interventions, so using websites, digital apps to really engage people in health behavior change and hoping that
Yes.
might move the needle in some of those important health outcomes.
Awesome. And so, with the health disparities that you're researching and studying, you see a heightened presence of that in the Northeast OKC community. Can you kind
Absolutely.
of speak to that a little bit more?
It's different now, of course, but there was historically a food desert. Medical options were sparse in terms of availability of parks and other safe areas where people can engage in recreation were limited.
Mm,
And so when you have environments like that, that increases the likelihood of poor health outcomes.
right,
And
right.
so one of the things I do as a community-based researcher, I really like hearing the voices of people in those communities, seeing what their needs are, and working with my institutional partners to see where we can kind of meet their needs and hopefully promote some level of health in those communities.
It's such an exciting time on the East Side because we see these resources being restored back into the community. We have some grocery stores, there's a lot of different investments and
Mhm.
really a lot of development happening around having more green
Yes.
spaces and walkability, but it's a long-term body of work. They don't have immediate outcomes. While it's exciting that some of these things are coming back into the community, and I know residents are really trying to focus in on how can we make some of this tangibly happen in the near term instead of waiting for years on end for some of these amenities and these really critical aspects of the built environment that impact our health. How do we make that better and stronger so people can have a quality of life today?
Mhm. And
So,
you're exactly right. Progress is slow, but it's happening. Northeast Health and Wellness Center, I think
yes.
two great facilities, one addressing food security, the other addressing physical activity and exercise. I think those are just two great examples. And you're right. We need more in that area.
Yeah.
And the way I try to contribute is by having digital outreach, making
Mhm.
sure that resources that we have at our healthcare facilities can go directly into those communities through that digital kind of pipeline. So I think,
Yes.
yes, progress is slow, but it's definitely happening. And
Mm.
so I didn't learn that history until I participated in the South of Faith project, hearing about how that area or that part of the city was gradually moved out of their communities because
Mhm.
the university was expanding, and that's very unfortunate.
Yeah.
And so seeing that in real time and knowing that kind of dynamic has created a culture of distrust, not only
Yes.
that exists in the community, but also at the institutional level as well, because I think there's been a lack of investment by OU, at least historically, in that area, when I think there's just so much potential for partnership and growth.
Right.
So that's changing now, along with strategic partnership in terms of community events and other type of opportunities for people.
So excited about the potential for us to even do more together because it does seem like South of 8 was helpful and people associated and affiliated with OU understanding that deeper history, because a lot of that history is not well documented unless you lived here and lived through that history. A lot of people do not know what really happened there. And so I'm excited for how OU has been so intentional about having a stronger presence in the community, and how can we continue to be creative and innovative about how OU can be a good neighbor and help repair and possibly restore some of those harms that were inflicted on the community. And we know that the leadership at OU today and the folks in your team were not the team that was with the institution in the 60s, but I think it's important that both of us being affiliated with OU and affiliated with the institution that does have that history, that we're being proactive about challenging ourselves and our institution to think about how can we repair harm, how can we be good neighbors, and how can we help reinvest in communities that the institution has a legacy of harming.
I think at OU there's been a dynamic shift in terms of their strategic vision as it relates to the not only the communities that exist within that campus, but also just the entire state. I think there's been a lot of leadership and faculty members going in there, identifying those people and groups, and really bringing them on board, connecting them to the resources, allow
Yes.
them to really help that community flourish. And I've seen that a lot here, and I'm
Yeah.
very excited about what the future holds, especially as they continue to grow that partnership.
I love how South of Eighth was helping build those relationships between folks that, we've all kind of worked around each other and knew of each other lightly, but to be able to sit in a room and have conversations and have dialogue and build trust and build relationships, I think has been so critical in helping the community understand, okay, how do we move forward and how do we do that in an equitable and inclusive way? And how can partners like OU Health Science Center be a part of this movement? My hope is that we can continue to build on that momentum and not let those relationships fall in between the cracks, but be proactive about how we stay in contact, we keep working together, and we keep listening to the needs of the communities that we're all serving. So, with the South of Eighth and you learning more about the community, the history, what happened here, who lives here, how did that shape you in your approach in the work that you're doing at OU?
I learned about the history through South of the Eighth, I knew that there were a lot of other things we need to tackle before we got to the research. And so I
Yeah.
really wanted to listen to people from the community, their experiences, their needs, and address those first before getting to, hey, here's a research study I would like for you to participate in.
Mhm.
Because I think that really spoke volumes to the people in that community, because that wasn't kind of the history up until that point. So
Yeah.
that's kind of the philosophy I brought to the table, only because I was able to experience the I think what your program or your project was offering by having
Yes.
people of different from different stakeholder groups sit down, have those very candid, tough conversations, and really,
Yes.
I think, feel the information that people like me can act on and really help try to make a difference in those areas.
A big focus with South of Eighth was this issue of connectivity, mobility, and access. How are people able to move around the community without a car like they were historically, and exploring different ways that we can really enhance pedestrian infrastructure so people can be safe, moving around, and making sure that their needs are met. And when you look around the South of Eighth area right now, that is a very significant challenge. And not only is moving around without a car difficult, but it really is unsafe in a lot of ways, especially when we think about 4th Street, a main corridor that goes to that neighborhood. There are no crosswalks, there's not really a lot of stoplights, and there's a beautiful park, Booker T. Washington Park, that's getting significant investment. But some of the feedback that we got is that a lot of people don't even feel safe going there. People are driving very quickly. And then also this challenge and deficit of community spaces. We know that a big part of someone's quality of life and sense of community is being able to gather and socialize. And so grateful for spaces like Culture Coffee that have created a community space and a cornerstone for that area. But people want to have more access to outdoors and be able to come together. And those are still some really significant challenges in the community.
So if you really look at some of the healthiest states and cities across the country, what you find, they have a very walkable space.
Yes.
Not only a walkable space, a very attractive space to walk in. So you actually feel the desire to want to be outside and walk around. And
Right.
so when you have areas that are still here in Oklahoma City where there's not a sidewalk, or there's no walking paths, or there's not a lot of green spaces, it becomes a very bleak and very
Right.
dry place to really engage in those kind of recreational activities. So that's what we
Yes.
really appreciate about the South of Eight project. They're trying to revitalize those spaces, bring those attractions to those areas that are also culturally informed, where people feel motivated to come outside and really engage in walking.
Right.
And through that, they're actually getting health benefits, mental health benefits. It's
Yes.
just economic benefits.
Right.
It's really a small change, but it can have a big impact. Putting sidewalks, walking paths, having those more greenery, that really adds a lot of value to communities.
Absolutely. And thinking about not just internally in the South of Eighth area, but how can people move and go to other areas of Oklahoma City? When we think about, so some of the biggest takeaways for me was learning from residents about the history of Deep Deuce. And I think a lot of us generally know that history, but to hear from people who remember a time where they could walk to Deep Deuce, go listen to music, get something to eat, go to the Jewel Theater on 4th Street, go to Florence's restaurant, have a date night. I mean, this really was a very built up, contiguous, walkable community. So thinking about internally in South of Bay, how can people get around more safely and easily, but even to other other areas that have been severed is such a big priority. And I think there's so much potential with the MAPS 4 dollars coming in and helping with connectivity initiatives and all the investments that the city is making to make the core of Oklahoma City a full-time community again. I think there's so much opportunity for the east side to be reconnected to areas that were taken away from the area, and for people to be able to move a little bit more easily internally in the neighborhood.
And I think the next step is seeing more action-oriented steps as it relates to that action plan within that PD. Also, just being in the community more. I think that's what we try to do at the Stevenson Campus Center, which is a part of the OU Health institution, is that we're actively going out to community events that are in that local area, but also across the state. I think being there and showing your face, I think,
Yes.
changes the perception
Yeah.
of what people, I think about an institution and also feel about an institution. And we're already seeing that in terms of the numbers, in terms of the people that are actually working at our institution. It's starting to become more diverse because we're starting
Yeah.
to make inroads in those communities that I think
It's great.
really wanted us to be there.
Our big goal is really helping make South Advance a community where people can move, families, young families with children can move there and live there full time again and have access to these amazing resources that we have right in Northeast OKC. But some people just don't even, maybe they don't know those programs are there, or they don't feel like those programs are for them. And so just raising awareness about what OU has to offer and how kids can get connected and learn more about the professions, I know is definitely a big priority for residents. Any other last remarks or takeaways from the South of Eighth work, or maybe ways that you hope to see the work implemented in the future?
I'll say this, my experience with the South Faith Project and just hearing this conversation here is really, it occurs to me that there's kind of a duality as it relates to the environment. The environment can either be used to divide people or it can be used to connect people. And I'm glad we have
Yes.
organizations such as yourself that's trying to advocate for environments to connect people, because we need that now more than ever today.
Absolutely.
So,
Yeah, couldn't agree more. And I love how the health industry and the industry of urbanism are really coming together in recent years to understand how the built environment is absolutely shaping people's ability to be healthy and well and reach their full potential. So I think there's so much opportunity for our organizations to keep working together and keep exploring how can the built environment, how can architects and urban planners and city planners think about health and think about how we can design and plan for communities where people can be healthy and age in place and live their best life and not have to flee Oklahoma City or the east side to have a healthier, just more positive lived
absolutely.
experience. Thank you for being a partner. Thank you for
Thanks
joining
for
me
having me.
today. We appreciate you.